for those who are not familiar, the Pan American Health Organization is the regional office for the Americas of the World Health Organization. We basically work with 51 countries and territories, and that is one of the biggest challenges that we have. And I was so happy to see that we have colleagues from St. Lucia, because we need to work with countries like Canada or Brazil, big countries, but we also work with small island development state and territories in the Caribbean, Central America, all around from Canada to Argentina. And then, of course, another challenge for the digital transformation is language. So we work in 4 official languages, that is Spanish, English, Portuguese, and French. But we also work, and in particular now, with indigenous populations, in particular, to ensure that nobody is leaving behind. So I will go fast. The way we see digital transformation of the health sector is that we are coexisting now in 2 models, the traditional model of care and the digital model of care, or of one of the previous presenters mentioned, the virtual care model. So, but basically what that means is, because there is a lot of confusion about around the world digital transformation for us, the way we see is to position the health sector in this digital age, or as the UN Secretary General called this, the age of digital interdependence. That means that we have to think differently, but also that we must act in a interdisciplinary way. This is bigger than health. And that is a key issue that we all need to embrace, and we all need to do something to position the health sector within the process of digital transformation of governments. So our framework at the Pan American Health Organization, that is fully aligned with the World Health Organization, is based mainly, we focus on improving information systems for health. There is a reason for calling that way and not health information systems, is because more and more we see, and we saw that during the pandemic, that the health sector needs data that is coming from different sectors and not only the one that under the administrative authority of health. It is critical, and in particular, and hearing the previous speakers, if we are going towards artificial intelligence, it is key to have a data management policies, a data governance framework, but also everything needs to be supported by a digital health strategy with some guiding principles. And then I will refer to this concept of open public health that we are promoting. So in regards to data management, and the data management model that we have is from governance to the ethical use of data, but we are also considering and taking into consideration technical principles. Some of them were already mentioned about, for example, there is a famous word right now, interoperability, but the key point is why we are still having this conversation if interoperability is an issue that we have had analyzing for the last at least 2 decades. There is something else that needs to be done. We need to reinforce the work on quality, adoption of international standards, cybersecurity, and this concept of openness. And I will refer to that later. But also, if we want to have some more transparent algorithms on artificial intelligence, we need to adopt some guiding principles. And the one that we are following at PAHU are the one defined by the Open Government Partnership that almost all the countries in the world are following. That is this concept of, in particular, that data should be open and machine processable. What do we mean with open public health? So if we want to avoid bias in algorithms, lack of transparency, and several issues that are going on right now in where legislators are analyzing the way to update legislations related to AI, is that we need to work and reinforce the concept of open data, open access to scientific information, open source for the development of public goods, open standards, open content for education, open science, open algorithms. And at the end, we need to embrace the concept of open government data. So based on that, we at PAHO did the consultation with all the countries of the Americas, but also with universities, academic and research institutions, and network of experts. And we agreed to focus public health in this age of digital interdependence based on 8 guiding principles that are universal connectivity. We are moving towards the concept of connectivity and bandwidth as new social determinants of health. If we want to go with telehealth on isolated or vulnerable populations, we need to have not only connectivity, we also need to have bandwidth. And these are not traditional areas to be discussing public health policy. So right now we need to position this concept as part of the renewal of public health policies and interventions. The concept of digital public goods. We have several countries in our region that can benefit from development from other countries, but also to ensure the adoption of international standards. We recently developed, together with the Inter-American Development Bank, a digital public good that is the digital documentation of COVID vaccine certificates. So countries can be aligned with the EU, for example, the Green Pass that they have for allowing international travel. So those kind of public goods are the one that we are promoting. Also an inclusive digital health, then the concept of interoperability, the concept of mainstreaming human rights across all the areas of digital transformation, artificial intelligence, and in particular, the big challenge that we have today is how to embrace artificial intelligence in public health policies. There is a lot of progress and advance in the areas of medicine, but there is still a lot of gaps in public policies. So this is our work right now, is focused on that. We are working and we are implementing a public health framework for artificial intelligence. And then, of course, everybody mentions information security. We are working with several countries in the Americas. They are facing a lot of cyber attacks. So that is key also to have a more robust instruments as part of government policies. And at the end, we believe that we need to redesign or rethink the public health architecture, considering this concept of a virtual model of care. But from the guiding principles, we presented that to all the ministers of health of the Americas, and they all agree to pass a resolution that was in 2021. So all the countries of the Americas, and we invite all of you to follow this process, because all of them agree to develop national roadmaps for the digital transformation of the health sector in the Americas that are being organized according to the 8 guiding principles that I just mentioned. So finally, I am looking at the clock. We believe, and that is part of the discussion with our member state, the countries, that we need to put the efforts on understanding and applying all the concepts around digital transformation. There is new elements here. Then we will have better outcomes in health. But this is, as I mentioned before, this is bigger than health, and this is bigger than one organization. So it should be seen as a collective effort between international organizations, government partners like you, research and academic institutions, etc. This is very simple, but for me it's a very, very robust message. We need to move from the concept of stay at home, that was around the world during the pandemic at the beginning, in particular, to this concept of stay connected at home. And that is critical for different factors. I will not go into any particular detail, but this is something that is extremely important to consider in the face of a potential next pandemic, but also for have more resilient health systems. So I will stop here because I see that I am already in 10 minutes. So thank you very much, Katerina, again for this opportunity, and Kirill also.